Hi, I'm Jasmine. I'm one of the PGY2 residents here at Beaumont Taylor in the Beaumont department. Welcome to our program. Let me tell you a little bit about it. So during my 4th year of medical school, one of the biggest things I looked at in a program was diversity. So when I had the opportunity to rotate here at Beaumont Taylor, I was shocked with how much diversity this program had between its patient population, its faculty, staff, and even its residents. Now, going into my 2nd year of residency, I am learning firsthand how social determinants of health really impacts a patient's outcome.
So when I came here for my interview, I immediately felt welcomed not only by the program leadership, but also by the residents and also the other hospital staff, even if it was just like a courtesy nod. So why does our program stand out? Well, I would tell you firstly that it's the people. When you have phenomenal individuals throughout the 4 years of your residency, bringing them together makes something really truly special. And it starts from your transitional year with the attendings and the diverse rotations that you have. And it trickles down from the top, from Dr. Mendez, Dr. Ho, Dr. Donovan, and you feel the effects throughout the whole residency program. Just like in many of the rehab programs, our PGY2 year tends to be a more difficult and tiresome year. It's where the bulk of your inpatient rotations will come from and the bulk of your calls. As a PGY3, we just finished the PGY2 year, I can agree that yeah, it was challenging, but I can also just as confidently say that it was equally as rewarding.
For entertainment, look no further than downtown Detroit, where there is 3 major stadiums, all for professional sports teams, within walking distance of one another. If you like football, baseball, basketball, or hockey, it's all there. In addition, Michigan has plenty of indoor and outdoor venues where you get to enjoy your favorite music artists. Usually there's 2 seasons in Michigan, summer and winter. There's water sports in the summer and ice sports in the winter, and everything in between. Even some stargazing if you're really into that. In addition, Michigan is known for their eating and drinking, their locally crafted coffee shops, breweries, and distilleries, and not to mention the outside influence in nightlife and restaurants, particularly with transplants from Chicago, New York, and LA, all looking to bring their own cultural influences into Michigan.
Hi, I'm Alex. I'm a PGY4, and I'm currently applying for a sports medicine fellowship position. From a didactic standpoint, our faculty-led lectures cover all the fundamentals of PM&R, and you get to join the lectures as a first-year resident to learn when you start your residency. We have a TBI fellowship, which dives even deeper if you're interested in brain injury. At the end of your 2nd year, the program directors make every effort to custom tailor your 3rd and 4th year block schedules to get as much of the necessary exposures to prepare you for fellowship applications. Personally, Dr. Ho and Dr. Donovan sat down with me and asked me what I was interested in. They arranged my schedule to provide ample outpatient clinical experience before my sports medicine rotation so I could get the most out of that rotation. I also feel prepared to go into a sports medicine fellowship because of the large procedure volume. We get firsthand and early exposure doing lots of botulinum toxin injections, joint injections, EMGs, ultrasound, and spinal injections, so you get very comfortable with the spectrum of PM&R procedures. I have co-residents who are applying to brain injury and spine fellowships, and I know they also feel very prepared for the next stage of their treatment. And so as you can see, the academic flexibility here is unparalleled.
I've had such a great time already. Going in clinic and interacting with PGY2s, PGY3s, and PGY4s, getting involved, and everybody here has just been so welcoming. The camaraderie, it's everything that I saw when I interviewed. For me, I wanted a smaller program so I could bond with residents, and I wanted one that was a 4-year categorical program so I could develop those relationships early on and get early training from day one. Plus, I didn't want to move, and I found that I've already been kayaking, going to escape rooms, and really spending time with the people that I'm going to be working with for the next 4 years, and that was invaluable to me. I also really wanted flexibility in scheduling and also in rotations, and this program really provided that for me. In this program, I've already been able to get involved with things like Twitter and even making this video, which I don't think I necessarily would have been able to do in an older program with a lot more rigidity.
Hi, I'm Eileen Donovan. I'm the program director of the Physical Medicine and Rehabilitation Residency program at Beaumont Taylor. Thank you for your interest in our program. Our program is an inclusive learning environment where we value diversity, camaraderie, and professionalism. Our faculty are enthusiastic, welcoming, and they are eager to teach. Training at Beaumont Taylor will provide you with the tools to thrive, whether you practice in an academic or a private setting. And our program is growing. Last year, we were approved to have 5 residents in each class, so you will be the second class with 5 in your class. Think about call, split about across 5 people. We have a 49-bed inpatient unit where you'd be caring for patients with a wide variety of diseases and disorders. 14 of those beds are on a neurotrauma unit where we specialize in traumatic brain injury and spinal cord injuries. Our residents get strong, custom-tailored training in the basic rehabilitation principles from day 1 in their intern year. We have didactic lectures every Tuesday morning. That way, when you go to the rehab floor in your second year, you will have a strong background already from the year's worth of lectures you've been attending, and you will have formed relationships with all of the other residents, so you will know them and they will know you when they are supervising you on the floor. Our training program has resulted in our graduates landing fellowships and jobs of their dreams. If all of this sounds good to you, please apply. Call us or email us if you have any questions, and we look forward to virtually meeting you.